Hi everyone, Hong Kong Press Live. We are talking to Ben Cowling today. He's the co-director of the WHO Coordinating Center for Infectious Disease Epidemiology and Control at HKU, and you may recognize his name from some of our news reporting on COVID-19. Thanks a lot for joining us, Ben.
Yeah, hi, nice to see you, Tom.
Well, perhaps you can reveal where exactly you are and fill us in just personally how you're going, because I've had nightmares about what you're going through at the moment. Yeah, fill us in.
I'm now in hotel quarantine. I went back to the UK in the summer to visit my family for a personal trip, and I came back about a week ago. I landed on Sunday, and then I've been in quarantine almost a week now, and I've got another 2 and a bit weeks to go for the 21-day quarantine until I'm allowed out back into the community in Hong Kong. I did think whether I want to go ahead with the trip, knowing that there's a long quarantine when I come back, but I decided to go for it in the end. And then there's a lot of other things that you have to sort out whenever you're planning that kind of trip. You have to figure out the flight schedule, make sure you can book your quarantine hotel, and I know that's been tough for a lot of people. And then think about how you're going to manage all the other stuff. You know, I've got a job, I've got meetings going on, I've got interviews, I've got students and lectures and all the other things that I've got to be able to do. So hotel Wi-Fi or Wi-Fi is really important for me, and all the other things that go along with staying in a hotel for 21 days, keeping active, keeping entertained, not going crazy by yourself in solitary confinement.
Well, I wanted to ask about exactly that, because if you follow Dr. Cowling on Twitter, you can see you're kind of threading or live tweeting what your experience of this has been. Are you holding it together? And you've got 2 weeks left. How are you personally coping?
It's gone quickly. It's almost a week. It's gone pretty quickly. I've had a lot of work going on. I've been busy every day. And I get to the end of a day and I was expecting that I could get a lot done because there's no distractions. You know, there's no people knocking on my door. But I get to the end of the day and there's still a lot of things that I haven't finished that I was hoping to finish. So I start again the next day, and I'm hoping that the next 2 weeks I'll be actually quite productive. I would like to have fresh air. I would like to have a bit of peace of mind. The air conditioning in the hotel is quite noisy, and it's a bit irritating at night that it is quite noisy, but I don't want to turn it off because then it's going to get stuffy because I can't open the window in this particular hotel. So I'm doing okay, actually.
Well, this is the big question, really, because Ben Cowling has gone to quarantine. I think you've argued that the length and nature of what is basically the strictest quarantine we know of in the world may not epidemiologically be, particularly necessary. Is this reinforcing your view? Yeah, I mean, what is the necessity of this? Do you think the government's got it right, or is it overkill?
Definitely, quarantine right now is an important measure in Hong Kong. It's important that people coming into the city are held in quarantine for a period of time to make sure they're not infected. We do a test on arrival, but you can have some people who test negative on arrival, but they had been infected before they left. They're incubating the disease, and so some point later it will show up, and then if they weren't in quarantine, then it will start spreading in the city, and we don't want that to happen. So quarantine is important. My question's been about the duration of quarantine, because there's always a trade-off with any measure like this. You understand that it's restricting the freedom of an individual, potentially even harming an individual. And there's been media reports of people with food poisoning, someone with appendicitis who didn't get very timely care, and so on. There's potential for harms of quarantine, but those are offset by the benefits to the community as a whole. So that, it's kind of justified on those grounds. But my question is about the duration, because my research, other people's research has shown that incubation periods are rarely longer than 1 week, maximum maybe 10 days, 14 days at a stretch, but 21 is going well beyond that, beyond what's really necessary. And I think beyond what's justified based on the incubation period, the epidemiology of the disease.
Can you still hear us?
Transmission of COVID in a quarantine hotel, which shouldn't happen, but it has happened. And then you get people that come out of quarantine after 2 weeks, say, who were infected in the hotel, and then they start spreading in the community. And I think maybe one of the motivations was someone tested positive on day 19, so we need to extend the quarantine to 21 days. But now we're going to have someone coming up day 24 positive, and then are we going to go 28 days quarantine? And it always seems to jump in 7-day intervals as well. We can only count in sevens, so it was either 7 or 14 or 21. I don't think there's any real epidemiological need for it to jump in 7-day intervals. So you know, I would question the duration, but then there's certainly a necessity for some duration of quarantine.
Thanks. I mean, you froze a little bit there, and I just wonder what your recommendation is. I mean, some countries are now looking at doing at-home quarantine for 7 days. What do you make of that? What should Hong Kong be doing there? And also, I think for a lot of us lay people, and we'd like to ask, you know, we thought that you get vaccinated and it will open up travel. What is the need, I guess, and how should one be treated differently if you're fully vaccinated when it comes to quarantine and travel?
I think there's a few different issues there to unpack. The underlying issue is, what's the long-term strategy for COVID? So if Hong Kong went down the path that Singapore is currently going down, of relaxing the COVID measures step by step, accepting that COVID's going to be here to stay, we can't put it off forever, and it's costing a lot to the economy to keep all these strict measures in place. If we go that direction, then the first priority is to get the vaccine coverage up. And one of the ways you can do that is by giving benefits to vaccinated people first as carrots. You can also go the other way, have sticks for people who are not vaccinated, to say, you can't do this, you can't do that. And around the world, countries have been experimenting with different incentives and different penalties for vaccination to get vaccine coverage up, because we know that's really, really important if COVID is going to be circulating. And I suspect that would have motivated the Hong Kong government's policy to say we can relax travel restrictions for vaccinated travelers, because that's one of the steps along the pathway to living with the virus. If we can do that, we get the vaccine coverage up to a high level. Vaccinated travelers can travel without quarantine first. And then as we get more and more relaxed about COVID, then everybody else can also travel without quarantine eventually. And that's what's going to happen in Singapore. But in Hong Kong, I think we're now going down a different path, which is this zero COVID path, even with a high vaccine coverage, following the mainland strategy. And if we're serious about keeping case numbers at zero, then quarantine, and strict quarantine, is really, really important. I mean, home quarantine is a nice idea. We did it early last year. But if we're going for zero COVID, you imagine someone who does home quarantine, who turns out to have COVID, spreads it to their husband or wife or their children, who take it into the community because they themselves are not quarantined, or someone comes to knock at the door and they invite them in for a cup of tea, and that person gets it and takes it out. You can imagine so many possibilities for the virus to get out. And if there's just one escape into the community that starts spreading, that's going to kick off the fifth wave. And we don't want that to happen. So I'm not keen on home quarantine. I'm very keen on the idea of following the Singaporean strategy and relaxing step by step. And then one of the steps would be relaxing travel for vaccinated people. But that's not consistent with the direction that we're going in right now.
I guess I have to ask, and not to corner you on politics, but do you feel that a lot of the government policy is being dictated by, you know, the potential Olympics in the mainland, us wanting to enter a bubble with China over, say, opening up to the rest of the world? Is this getting in the way of, you know, letting the science guide things? Also, for instance, you know, social distancing, a lot of these measures, despite us being promised, you know, behave yourselves and comply, then they can be relaxed. It doesn't seem that the government are willing to budge on things like 4-person limit and masks. Is Hong Kong's political, you know, position, the awkward rock and a hard place it often finds itself in between, you know, east, west, the mainland, is it getting in the way of things? Do you observe that with a lot of the policies?
So I'm a public health expert, not a political scientist or economist. So I'm not an expert in those aspects, but I can see there's a lot of politics involved. I can see there's a lot of advantages for the zero COVID strategy. If Hong Kong could stay free of COVID for the next year, for the next 5 years, for the next 10 years. As a public health advocate and public health scientist, that's fantastic. That means we don't have those deaths from COVID. We don't have those severe cases, the long COVID that we've heard about in other countries. We won't have that. So that would be fantastic. But there's the other side of the coin, is the economic implications of that, the restrictions on movement, the local policies like the gathering bans, the masks and so on, that I think we're getting a little bit tired of. For the zero COVID strategy that we're now following in Hong Kong, there's a lot of upside. If we can establish an open boundary with the mainland, there's a lot of people that want to travel backwards and forwards for business reasons. We keep the case numbers at a low level. That's great for public health as well. My concern is that it's a risky strategy. In my opinion, it's a little bit of a gamble, and I'll tell you why. So for now, everything's fine. We're happy. We've got 0 cases in the community for quite a number of months. Vaccine coverage is going up. It's not that high. But sooner or later, we will have infections in the community. We can kid ourselves and say we're so good, quarantine's brilliant, CHP is doing a really good job. They are, but that's what Taiwan said, that's what Singapore said, that's what Australia said, that's what New Zealand said. Sooner or later, we will have transmission in the community. When that happens, we're not quite in the right position to handle it. If we're going to sustain the zero COVID approach, that means when there is that outbreak in the community, we got to get the case numbers back down to 0 as quick as possible. That was tough in our 4th wave. It's now a bit of a distant memory. It was last Christmas, November, December, January. There was a lot of measures brought in to keep that 4th wave under control, to bring the numbers down all the way back down to 0. And it took ages. It took months. The Delta strain that's now prevalent worldwide is 2 to 3 times more transmissible, and that means 2 to 3 times more difficult to control than the strain we had in our 4th wave. That means if we simply do what we did before in the 4th wave, it won't be enough. So most likely, to sustain the zero COVID approach, the government would need to do what's being done in Macau, in mainland China, when they have outbreaks, which is essentially shut the city down for a period of time, maybe a week or 2 weeks, and test everybody repeatedly. If you don't go that far, if you don't go to that extreme, it's very difficult to stop it from spreading. And that's when you get to the other possibility, and the other problem is if the government are not able to bring the numbers under control, if we can't get back down to 0, our vaccination coverage isn't high enough, the community is really going to suffer because of that. There's going to be a lot of infections, a lot of severe infections that we could have averted if we'd had a higher vaccine coverage. But right now, I can understand the vaccine hesitancy when there are side effects of vaccination. We've documented some of them in the Faculty of Medicine, Hong Kong U. There's a rarely 1 in 10,000, 1 in 100,000 people get vaccinated will have some kind of reaction that's not very nice. And when you've got the risk of COVID, of course, then you accept a very, very, very low risk of a side effect. But when there's no COVID about, it's a more difficult decision to make, especially for older people who are worried about their health. So I can understand when we got zero COVID, there's vaccine hesitancy, but that's leaving us vulnerable to this spread of COVID. So my concern for the risk is that if or when transmission does occur in the community, it will happen sooner or later. Either the government's going to have to be very, very stringent, which I suspect people in the community will be like a little bit uncomfortable with, because it will be the kind of measures that are used in the mainland and in Macau. And if that doesn't happen, or if it doesn't work for some reason, then we got a big COVID epidemic, bigger than what's happening in Singapore, Australia, or New Zealand, because our vaccine coverage isn't that high. And so I would actually prefer to see a little bit of a different direction, more like Singapore, where we can have more control over our own destiny, over what's going to happen. If we say, we got a plan to relax the measures step by step, starting in, November, starting in December, starting in January, starting next year in March, whenever, we control it. We're going to keep zero until then, and then progressively we're going to relax. We can look to Singapore for what we should expect is that there will be infections in the community. There'll be a lot of mild cases. There will be a small number of severe cases, mostly in people who haven't been vaccinated. And so we recommend everybody to get vaccinated, bring in some more incentives, maybe even bring in some of those other things to really get the vaccination rate as high as possible. And then it's on our terms. We know what's going to happen, and we are kind of in control of our own destiny. But of course, the downside of that strategy of following Singapore is that we won't have the opportunity to open the boundary with the mainland, which means a lot to a lot of people in Hong Kong, having the chance to travel for business, to visit their families. I went to the UK to visit my family, but in Hong Kong, most people's families would be here, or some of them would be in the mainland as well, not in the rest of the world. So I can understand there's pros and cons of each approach. I just feel there's a risk that maybe hasn't been recognized for the zero COVID approach.
Yeah, it seems we're pretty committed to that approach when it does appear to be going out of fashion in Asia, Asia Pacific, some countries, just desperate to rescue their economy and open up. And I suppose you touch on how we will really need to, get serious again, should we get a Delta outbreak, and who knows whether, keeping these social distancing guidelines in place when times are good is going to make people a bit lazy or resentful, when we really have to, respect them when things kick off.
That's right. We've been monitoring the compliance with all of these social distancing measures over the past 18 months, and there is evidence of fatigue. You can see it around you, that the people are tired of doing these things all the time. And one of the things I have to say is that an advantage of the zero COVID approach is you have to be very strict at the borders when you've got zero case in the community, but you can relax all the domestic measures. So I would say actually kids can go back to school full time. The cinemas can be open, and you can have popcorn in the cinema, which is not the case today. Businesses can be open. You don't need to wear masks outdoors. You could say, okay, to be careful, we'll still wear masks in crowded areas. But outdoors, there's really no need to wear masks. When we're at zero cases, of course, if there's suddenly some cases in the community, we need to snap back. Masks, social distancing, stopping large gatherings, especially indoors. So that means closing bars, nightclubs, cinemas, karaoke, the lot, everything that's been done before. But when times are good, I think that there should be more relaxation. Actually, it's a safe time to do it, and we should take advantage of the time when we're at zero, because that is one of the advantages of a zero COVID strategy.
Well, couple more questions. The issue of vaccines, if you look at some of the statistics, I know you'll have seen in the past week or two, I know we've had a couple of typhoons, but the take-up has really slowed to a trickle. I guess, what went wrong here? Do you feel that there should have been more incentives earlier on? And, we do ask Chief Executive each Tuesday, what can the government do more? And I think she's put the ball back in the court of families, doctors, and the media to convince people to do this. Should we have perhaps linked the consumption vouchers or something to these vaccines, or what can be done at this stage? What have you observed elsewhere? How do we convince Hong Kongers to get up to? I think the government want to see basically 100%.
Well, I still see risk as the biggest motivator, and I can totally understand hesitancy when there's an absence of risk of COVID. There's the side effects that people are worried about, which are very, very rare, but they are documented. There are some cases of side effects. And at the same time, there's no COVID. So actually, if we follow the plan of zero cases in the community, rapid control of any outbreaks that do occur, like in Macau just recently, like in some mainland cities in recent months, if we're successful in that, it doesn't matter that we don't have a high vaccine coverage. It wouldn't matter if we have zero vaccine coverage or 100% vaccine coverage. Either way, we'll still have very few cases in the community, and we'll have a boundary open with the mainland potentially. We'll have, relaxation of measures domestically. Vaccination is not the priority. But my concern, as I said earlier, we've got this risk that if or when Delta or COVID does come into the community, if the vaccine coverage isn't that high, and if we can't stop it, or we can't stop it quickly, there's going to be a lot of serious cases of COVID, particularly in older people. And that's a risk that I'd really like to see mitigated. So we cover the bases. We say, okay, we'll go for zero COVID. Hopefully that's going to work, fingers crossed. If it doesn't work, still is not going to be too serious, because it's going to be very embarrassing for Hong Kong if the rest of the world's going back to normal and, you know, low numbers of cases, low numbers of COVID deaths, and then suddenly there's a massive spike in Hong Kong, a lot of cases, and unfortunately, a lot of severe cases in the elderly, such a long time into the pandemic when we've had vaccines available for so long. So I don't know the best way to motivate older people to get vaccination, and I understand why they're reluctant. I'm not keen on the idea of setting a target for the boundary to reopen of something like 70% or 80%, because that's kind of asking some people to get it, and then others are going to look to, you know, maybe they don't need to get it, and they, you know, there's a game theory issue about, you know, who's the volunteer to do something for the greater good, and I don't know if that will work. Consumption vouchers can give it a go. There's other ways to incentivize vaccination apart from money, but in my opinion, it's really risk that's the greatest motivator. And I'm kind of sympathetic. If the government said, we'll stay like this until, I don't know, next summer, if I had an older relative in Hong Kong, I might be telling them, hold off until next spring, because then in the summer when COVID's going to be back, you've got that highest level of protection because you've just been freshly vaccinated. And the rest of us who were vaccinated, you know, months ago, our immunities come down and we might need a third dose. And, you know, it's difficult with a zero COVID strategy. It's kind of, there's a lot of complexities and a lot of other issues that make it, in my opinion, a little bit more risky than you might have imagined.
But briefly, before my last question, what about the issue of the third dose and the health code? Do you think these are good ideas to roll out as soon as possible in Hong Kong?
So the health code has proved its value in the mainland. It's let them stamp down on outbreaks, because when there was an outbreak in, I don't know, Guangzhou, or an outbreak in Shanghai, wherever, you know, there were some cases from that city who left and went to other cities in the same province, or even went to other parts of the country. And because of the health code app, they could be immediately tracked down and quarantined and tested and so on. In Hong Kong, we don't need it for that reason, but it would be a way to ensure compliance with mass testing if the government went down that path. Your first question was about the third dose. That one is difficult. So again, it depends on the strategy. If we go for zero COVID and we're confident that we can succeed in zero COVID for the next year, that means even if or when there are outbreaks in the community, they can be quickly controlled. We don't need a third dose now, and it may do more harm than good. It may cause side effects. It may lead to small numbers of those serious reactions. And at the same time, that the benefit is not needed. On the other hand, though, if we do third doses, let's say in the coming 3 months over Christmas, the New Year, and then we have a plan to reopen in the summer, okay, it's a possibility. Actually, the third doses would have been done too quickly. We should have waited until maybe the spring, because then you've got that better protection from the third doses coming into the reopening phase. And if you look at Singapore, they're doing their third doses right now, which is going to be probably the optimal timing for third doses. So it is not as simple as saying our immunities come down, we need the third dose to boost it up. Because if we do third doses now, we can't do another round next summer, maybe even later next year. It will be too soon. We can't give fourth doses, fifth doses, sixth doses. It doesn't work that way. There's some immunologists saying that a third dose is actually should be considered fully vaccinated. We say that after 2 doses, you're fully vaccinated, but there's some immunologists saying that actually it's the third dose that's really bringing you to a status of fully vaccinated. And then after that, you may not need another jab, a fourth dose, for a long time. You know, the third dose may be a really good kind of final boost in the initial vaccination program. We don't know that yet, but it's certainly a possibility. So I'm kind of hesitant to think about doing third doses now when it's not clear that we need them now. If we can sustain the zero COVID approach, we might benefit from waiting until we decide we're going to relax, or until we see signs of a community epidemic that can't be controlled, and then that's the time to start a third dose campaign. Because we have to recognize that the vaccines do have downsides as well as the benefits they provide against the disease that you're protected against by the vaccine. And that there's, as I said, there's the reports of side effects, which are very, very rare, but not zero, that there have been documented side effects.
Well, finally, I think a lot of us would like to hear from you on, well, you don't have a crystal ball, but what is life going to be like, you know, in the years to come, in that broadly, what is the escape route from this? And is there an escape? Is this going to be with us for decades, perhaps? Do we have to live with it like the flu and treat it in a similar way? And when you've got such inequality of, say, vaccine coverage across the world, I think just a couple of percent in a lot of African states, will we ever go back to the sort of open travel we enjoyed beforehand? And how, yeah, broadly speaking, as best as you can, perhaps, what kind of timetable and globally are we looking at in terms of having some sort of normalcy again?
So, I mean, firstly, talking about flu and common colds, in past centuries, when explorers went to new areas of the world, I don't know, the Amazon jungle or whatever, they brought with them their infections like coughs and colds and flu. They were devastating, because if you're an adult, the first time you get some of those viruses, they can be nasty. But when you've had them as kids, when you've had colds, when you've had flu as a kid, when you get older, you get reinfected through your life. We all get coughs and colds, but they're not as serious anymore. I think COVID is going to be like that. So it's having a massive impact now, but in 10 years' time, I think when we get COVID, it's going to be more like flu, more like the common cold. Undoubtedly, it will still be severe in some people, but it's not going to be the kind of infection that justifies lockdowns and massive social distancing.
Is that what we're talking about, sorry, when we talk about herd immunity? And how does that link in with unimaginable new super infectious variants? Are we going to be battling those for years?
Yeah, it's difficult to predict what's going to emerge in the future. I think Delta was a bit of a surprise, that the virus could change into such a more transmissible form. You know, you can imagine a virus getting a little bit better, but Delta's 2 to 3 times more transmissible. That's a big improvement in the virus. In the future, it's difficult to say if something like that's going to happen again. Hopefully not. With flu, the virus continually changes, and so we have to have a updated flu vaccine every year. And for COVID, it may be something similar. There will be updated vaccines from time to time. For sure, with immunity, it's not exactly the same as herd immunity, but certainly as immune levels get higher, as more people have been vaccinated or infected, and in some cases repeatedly, the immune level is going to go higher and higher, and COVID is not going to be such a serious infection anymore. If we get it, it's going to be milder, and oftentimes when we get exposed, we won't even get infected. So I think in the years to come, it's going to be a threat like flu is, and some years there's going to be, you know, the hospitals crowded with COVID patients, maybe with the latest variant, but it's not going to be anything like as serious anymore. In terms of the exit route, I think most of the world is now on their exit path. They're on the off ramp of the highway. They're not planning to do anything very drastic anymore. Singapore are doing it kind of step by step. So we will look carefully and see how things go there, and also Australia and New Zealand. But in Europe and the US, the case numbers are already coming down, and they've relaxed all their measures for a while now already. And so I don't think we're going to see a major health impact of COVID around the world anymore. This winter, maybe case numbers will be up a bit, but with the vaccines we have, with the treatments as well, remember there's this new one, molnupiravir. There's a few other effective treatments that are also in use. They make it kind of easier to treat. So the vaccines prevent it or make it milder. Even if you do get it, there's treatments that can help. So it's not such a threat anymore. And in most of the world, it wouldn't be considered a public health emergency anymore. Most likely, the WHO will say it's the end of the pandemic. And then in China, in Macau, in Hong Kong, we'll still be having our public health emergency and all these measures in place for a while longer. I hope not for too much longer, because I think we can safely start looking to get back to normal step by step. But the first part of that is to make a plan and a timeline. And then once you have that, then you can go and increase the vaccine coverage and start to give incentives to vaccinated people, and then go step by step in the relaxation of all the policies.
Well, Dr. Ben Cowling, thank you so much for joining us from quarantine. I guess you've got a couple of weeks left. It's super fascinating, if not sometimes reassuring or bloody terrifying to speak to you more in depth, because we can only get a couple of sentences in a lot of the time in our reporting. So thanks very much for joining us.
All right, thank you. Bye-bye.